The night began like any other night at St. Agnes Hospital. The lights in the emergency room were bright and steady. Machines beeped in a slow, familiar rhythm. Nurses moved between beds, checking charts, adjusting IV lines, and speaking softly to patients who were scared or in pain. Marisol Reyes had worked in this emergency room for almost 3 years. She was known for being calm and quiet. She rarely raised her voice. She rarely smiled too much either. She simply did her job, one patient at a time, one task at a time. Most of her coworkers did not know much about her past. They knew she showed up early, stayed late when needed, and never complained. What they did not know was that before she became a hospital nurse, Marisol had spent 6 years as a combat medic in the Army. She had worked in dangerous places, under difficult conditions, where every second mattered and mistakes could not be fixed. She never talked about those years. She kept that part of her life folded away, like an old uniform in the back of a closet. That night, everything changed in an instant. It started with shouting near the front entrance. Then came the sound of the main doors being forced open. Within seconds, 2 men entered the emergency room. They were carrying weapons, and their faces were filled with anger and fear. One man moved quickly, shouting orders. The other stayed near the entrance, watching everyone with sharp, nervous eyes. Patients froze, nurses froze. A young receptionist dropped her clipboard, and the sound of it hitting the floor seemed impossibly loud in the sudden silence. "Nobody move," the first man shouted. "Nobody call anyone. Nobody leaves." The emergency room, which had been full of movement and noise just moments before, became still. Machines kept beeping. Somewhere, a monitor let out a soft, steady alarm, but no one dared to speak. Marisol was standing near a supply cart when the men entered. Her first instinct was the same as everyone else's: fear. Her heart began to race, and her hands felt cold. But something else began to happen inside her, something she had not felt in years. It was a kind of quiet focus, like a switch being turned on. She remembered this feeling from her years overseas. It was the feeling of a mind choosing to work instead of panic. She did not run. She did not scream. She simply lowered her eyes slightly and stayed still, watching without appearing to watch. The 2 men moved through the emergency room, checking each area. They ordered doctors and nurses to stay near the walls. They told patients to remain in their beds. No one was allowed to use a phone. No one was allowed to leave. Hours passed like this. The gunmen paced back and forth, growing more tense as time went on. Outside, sirens could be heard in the distance, but the men inside made it clear that no one was allowed to communicate with anyone outside the building. Despite the fear in the room, some patients still needed help. A teenage boy in one of the beds had been in a car accident earlier that evening. His arm was wrapped in a bandage, but the wound underneath was serious. As the hours passed, his condition began to worsen. His face grew pale, and his breathing became shallow. Marisol noticed this from across the room. She had been trained to notice small signs that most people would miss: the color of the lips, the rhythm of breathing, the way a person's eyes begin to lose focus. She knew that if nothing was done soon, the boy could be in serious danger. She looked toward the calmer of the 2 gunmen, the one who seemed to be in charge. She spoke carefully, keeping her voice low and steady. "That boy over there needs help," she said. "If I don't check on him, he could get much worse." The man studied her for a moment. His eyes were tired, and his grip on his weapon seemed less steady than before. "Why should I trust you?" he asked. "Because I'm not trying to escape," Marisol said. "I'm trying to keep someone alive. That's all I know how to do." There was a long pause. The room seemed to hold its breath. Finally, the man gave a small nod. "Move slowly," he said. "No sudden movements." Marisol nodded and began to walk toward the boy's bed. Her steps were calm and unhurried, even though her heart was pounding. She had learned long ago that fast movements made frightened people more frightened, and frightened people with weapons were dangerous. She kept her hands visible and her voice gentle. When she reached the boy's bedside, she saw immediately that his bandage needed to be changed. The bleeding had not stopped completely, and his body was showing signs of shock. She began to work quickly, but smoothly, unwrapping the old bandage and applying pressure with a fresh one. "Hey," she said softly to the boy, "I need you to look at me, okay? Not at the ceiling. Right here." The boy's eyes fluttered, and he turned his gaze toward her. "There you go," she said. "You're doing great. Just breathe with me. In and out. That's it." As she worked, she kept talking to him in a calm, steady voice. She asked him simple questions: his name, his favorite subject in school, whether he had any pets at home. It was not just conversation. She was watching how he answered, checking whether his mind was staying clear or slipping away. His name was Daniel. He was 16. He had a dog named Biscuit, and he liked drawing more than sports. "Biscuit is a great name," Marisol said, smiling gently as she finished securing the new bandage. "Better than sports, if you ask me." Daniel gave a weak laugh, and some color slowly began to return to his face. The calmer gunman had been watching this entire exchange from a short distance. He seemed surprised by how steady Marisol remained, even with weapons in the room, even with danger all around her. Something about her calmness confused him. Most people reacted to fear with panic or begging. She reacted with focus. "You've done this before," he said, not quite a question. Marisol did not look up right away. She finished checking Daniel's pulse before answering. "I've done a lot of things before," she said simply. The man studied her for a long moment, as if trying to understand something he could not quite name. Then he turned and walked back toward the entrance, watching the rest of the room again. As the hours dragged on, other small emergencies appeared. An older patient's heart monitor began to beep in an unusual pattern. Another patient, a woman recovering from surgery, began to panic quietly, her breathing becoming fast and uneven. Each time, Marisol asked for permission to help, and each time, though hesitant, the calmer gunman allowed her to move. She never raised her voice. She never argued. She never tried to convince him to let everyone go. She simply focused on what she could control, the patients in front of her, one at a time. Inside, her training from years earlier kept guiding her. She remembered lessons about staying calm under pressure, about how a steady voice could calm not just patients, but also people holding weapons. Fear fed on itself, but calm had a strange way of spreading too, if someone was brave enough to offer it first. The second gunman, the more nervous one, grew more anxious as time passed. He paced near the doors, glancing outside every few minutes. The sirens outside had grown louder, and it was clear that police and negotiators were gathering. At one point, he raised his voice, frustrated and scared. "This isn't working. They're not listening to us." The calmer man tried to steady him, but the tension in the room grew heavier. Patients who had been quiet became more nervous again, sensing the shift in mood. Marisol, who was checking on another patient nearby, paused. She understood that fear could turn into panic very quickly, and panic could lead to mistakes. She needed to bring the focus back to something steady. "Everyone here just wants to stay safe," she said quietly, not moving suddenly, not raising her hands, simply speaking with calm honesty. "That includes you too." The nervous gunman turned to look at her, startled that she had spoken directly to him. "You don't know anything about what we want," he snapped. "You're right," Marisol said. "I don't. But I know that hurting people in here won't get you what you want either, so maybe the only thing we can control right now is how calm this room stays." There was a tense silence. For a moment, it seemed like her words might make things worse, but slowly, the nervous man's shoulders dropped slightly. He did not answer her, but he also did not argue further. He simply turned back toward the door, his breathing slower than before. Hours continued to pass. Outside, negotiators were working to communicate with the two men through a phone line connected to the front desk. Marisol could hear pieces of the conversation from where she stood, though she tried to focus on her patients instead of the tension building near the entrance. Eventually, word came that the men were willing to release some of the patients in exchange for certain requests being considered. Slowly, in small groups, some people were allowed to leave the emergency room under close watch. Each time a group left, the room grew quieter, the remaining patients and staff waiting anxiously for their turn. Marisol chose to stay near Daniel and the other patients who could not easily move. She continued monitoring their conditions, offering quiet reassurance whenever fear crept back into their eyes. As dawn approached, the situation outside reached its final stage. Negotiators had convinced the two men that surrendering peacefully was their best option. After many hours of tension, The calmer gunman finally agreed to put down his weapon. The nervous one hesitated the longest, but eventually, exhausted and out of options, he did the same. When the police finally entered the emergency room, they found a scene very different from what they expected. Instead of chaos, there was quiet order. Bandages had been changed. Patients were stable. A calm nurse stood beside a teenage boy, still gently reassuring him that everything was going to be fine. The story of that night spread quickly through the hospital staff, and eventually beyond it. People spoke about the composed nurse who had somehow kept her patients safe during hours of fear and uncertainty. Few people knew about her time as a combat medic, and Marisol did not feel the need to explain it. She simply returned to her regular duties once the ordeal was over, restocking supplies, checking on patients, and moving quietly through her shifts as she always had. When a reporter later asked her how she had managed to stay so calm throughout the entire event, Marisol thought carefully before answering. "I just did what I was trained to do," she said. "Focus on the person in front of you. One step at a time. Panic doesn't help anyone, but calm sometimes does." She did not consider herself a hero. She considered herself someone who had simply done her job under difficult circumstances, the same way she had been trained to do years before, in a very different place, under very different skies. Daniel, the teenage boy she had helped that night, made a full recovery. Months later, his family visited the hospital to thank her personally. He brought a small drawing he had made, a picture of a dog, labeled simply, "Biscuit." Marisol kept it pinned near her locker, a quiet reminder of a night that had tested everyone's courage, and of the calm that had somehow carried them all safely through it. Life at St. Agnes returned to its normal rhythm soon after. The lights stayed bright, the machines kept beeping in their familiar patterns, and Marisol continued walking through the emergency room each night, calm and quiet as always, carrying within her a strength that few people around her ever fully understood.